I'm Barbara, and I'm at the Natural History Museum, and welcome to our program, Pandemic Past, Pandemic Present. I want to give folks a little time to sign in, and there's lots of people registered for this program, which is very exciting. So let's just give folks a chance to get into the program, get settled. And for those of you just joining us, I'm Barbara Stauffer at the Natural History Museum, and you've just joined the Pandemic Past, Pandemic Present program. Welcome. And I see that Tara joined us. Welcome. Great. So I think I'll get started. We'll probably still have a few people join us as we progress. Again, I'm Barbara Stauffer. I'm Chief of Community Programs at the Natural History Museum, and I'm joining you all from my home in Washington, D.C. So on behalf of the museum, it's my great pleasure to welcome you to this virtual program. Again, Pandemic Past, Pandemic Present. It's a webinar inspired by our exhibit, Outbreak, Epidemics in a Connected World. And we're delighted to share this information and this program with you. I know it will be a very interesting presentation. I'd like to thank at this point the many organizations that supported the Outbreak exhibit and associated programming, including those that provided funding. So before we dive in, I do want to be clear that this program, while we welcome all viewers and all attendees and participants, this program is for an adult audience. And if you're looking for something designed expressly for students and families, we have many other programs such as our Smithsonian Science How program for middle school students, Natural History at Home for families. These are just some examples of programs we have, and you can find more information about those on our website. The URL will be posted in the chat box. So today we have the pleasure of hearing from Mark Honigsbaum, a medical historian and author specializing in the history and science of infectious disease. Mark has written 5 books, his most recent one being The Pandemic Century, 100 Years of Panic, Hysteria, and Hubris, a very timely topic. After a brief presentation, Mark will take a few questions from our moderator, and then we'll open the Q&A to all of you in the virtual audience. So please just take a moment to locate the Q&A box feature. It's located either at the top or the bottom of your screen, and you'll need that to submit questions later in the program. We're delighted to have such a large audience. Last I checked, we have over 600 people in attendance, which is very exciting. It does also mean it might be hard to get to every single question, but we'll get to as many of them as we can. Keep an eye on the chat box as well. This is where the museum staff will provide answers or additional information as relevant. And finally, please fill out our survey after the program. It will appear in your Zoom browser window when you exit the program. Now, I'd like to welcome our moderator, Sabrina Sholts. Sabrina is a biological anthropologist who studies connections between human, animal, and environmental health. She's also the curator for the Outbreak exhibit. Welcome, Sabrina.
Thank you, Barbara. Thank you, everyone, for attending today. It's very exciting. There are so many of you. This is the second virtual program for Outbreak, which is part of a much longer series of programs that we've been doing in support of the exhibit for more than 2 years. We're actually coming up on the 2nd anniversary of the exhibit's opening this week, which is pretty remarkable given how timely that content is. Outbreak is all about emerging infectious diseases, new zoonotic viruses, and pandemic risks. So, the major global challenges that we faced then and before, and certainly never more than today. The main messages of Outbreak are, one, health, that human, animal, and environmental health are connected. And we illustrate the importance of that perspective with science and stories about emerging diseases that have increasingly confronted us over the last century. We opened in 2018 at the centenary of the 1918 influenza pandemic, and it used that experience to contextualize future pandemic threats. that's entirely appropriate that with today's program, we can bring that conversation up to date with a world expert on this subject. Mark Honigsbaum is a medical historian, journalist, and academic with wide-ranging interests encompassing health, technology, and contemporary culture. He's a regular contributor to The Observer and The Lancet. He is the author of 4 books, including The Fever Trail, In Search of the Cure of Malaria, and Living with Enza, the story of Britain and the Great Flu Pandemic of 1918, which was longlisted for the Royal Society Science Book of the Year in 2009. His most recent book, which I adore, The Pandemic Century, 100 Years of Panic, Hysteria, and Hubris, was named the Health Book of the Year in the Financial Times and the editor's pick in the New York Times. Norden will publish a paperback edition with a new chapter on the COVID-19 pandemic this summer. Mark is currently a lecturer at City University of London, where he is researching the role that the media and partial or incomplete scientific knowledge of vaccines plays in the spread of anti-vax conspiracy theories. Alongside his academic work, Mark produces a podcast, Going Viral, and animations on the history of science and medicine. His animation, How Pandemics Spread, has been viewed more than 2.6 million times on TED. I will also note that Mark participated in one of our outbreak programs last summer, physically at the museum, when the hot topic of that conversation was measles. Good old days. So we are absolutely thrilled to welcome him back virtually today. Mark, please take it away.
Well, thank you for that lovely introduction, Sabrina. And thank you also to Robert Costello and Ashley Peary for organizing this event. Yeah, thank you for reminding me of the event I attended last August on measles. I must say, it seems that an eon ago, a lot has happened since, but I'm very, very pleased to be able to join you today virtually, at least via Zoom. So the title of my talk today is The Pandemic Century, from the Spanish Flu to COVID-19. So here goes. A novel virus emerges from an unknown animal reservoir and silently seeds itself in cities and towns across the globe. Then, without warning, the infection explodes in multiple countries and continents at more or less the same time, filling hospitals with patients with severe breathing difficulties. Now, I'm not referring to COVID-19, of course, but to a pandemic that occurred a little more than 100 years ago at the height of the First World War, the so-called Spanish influenza. Now, like the coronavirus, no one knows precisely where the flu originated. One theory is Kansas, another is northern France, and a third is China. About the only thing we can say for certain is that the 1918 to 1919 influenza pandemic did not start in Spain. The term Spanish flu was coined by newspaper correspondents in Madrid who were not subject to the same reporting restrictions as applied in a belligerent nation such as Great Britain. Now, by the time the virus burned itself out in the spring of 1990, it's estimated that something like a third of the world's population had been infected, and at least 50 million people were dead, including, I'm sad to say, 675,000 Americans. Yet, except for those who watched loved ones succumb to the deadly pneumonic complications of the disease, or who nursed patients on influenza wards and had lost colleagues to the infection, the virus made little impression on the collectivity of society. And this is a very famous quote from Alfred Crosby, an American environmental historian, and one of the first historians to actually write a detailed history of the pandemic. And Crosby famously remarked that Americans took little notice of the pandemic and then quickly forgot whatever they did notice. By contrast, I think it's safe to say that even though we're just 6 months into this pandemic of COVID-19, and it's only just 6 months since SARS-CoV-2, to give the coronavirus its formal name, emerged in or near an animal market in Wuhan in China, there seems little danger of COVID being similarly forgotten. Now, this is not only because the coronavirus has emptied our skies of planes and cleared our cities of traffic, or that thanks to 24/7 rolling news coverage and social media, we're able to follow the progress of the coronavirus in real time on multiple screens. It's primarily because the economic impacts are likely to be huge, with some economists predicting the world will be plunged into the worst depression since the 1930s. That is something that did not happen in 1920. On the contrary, while the Spanish flu pandemic depressed manufacturing output in some US cities, in other cities, such as St. Louis, where suppressive measures were applied early on, saw a relative increase in economic output after the pandemic. And while in 1918, the bulk of the mortality fell on the most productive sector of the population, namely young adults aged between 20 and 40 years, those that survived the pandemic went on to enjoy longer lifespans and, in many instances, benefited from higher wages too. So I guess my point is that we shouldn't assume that pandemics are always unmitigated disasters that are bound somehow to be etched in public memory. Nor should we assume that medical and other experts are always right. On the contrary, one of the key lessons of the last 100 years of epidemic and pandemic alarms, and a major theme of my new book, is that experts are prone to hubris, and that too much knowledge, or the wrong sort of knowledge, can be a trap, blinding us to the pandemic just around the corner, or, just as often, causing us to forget the ecological and social lessons of past epidemics and pandemics. So let me give you an example. In 1918, most scientists were convinced that influenza was a bacterial disease. Few had any conception that it might be a virus. This was because in 1918, electron microscopes had yet to be invented, and viruses were too small to be seen through the lenses of then optical microscopes. The result was that when bacteriologists took throat washings from influenza patients and cultured them on laboratory media, they saw them teeming with tiny bacilli. Now we know that the majority of these bacteria that they saw on these plates were Haemophilus influenzae, a bacteria commonly found in the nose and throat, and which is associated with meningitis. Another misconception was that influenza was generally a mild infection that only posed a threat to the elderly or to those with underlying respiratory conditions, such as bronchitis and tuberculosis. Flu does indeed pose a threat to such groups, but in 1918, as it had during the previous 1890 Russian influenza pandemic, which you can see depicted in this image, it also attacked younger age groups and robust individuals, such as burly London policemen. On such occasions, people refer to influenza as a fiend, and they often compare the disease to a plague. Unfortunately, by 1918, there were few physicians still practicing who recalled the depredations of the Russian influenza and the common respiratory and nervous complications of the disease. Furthermore, only a handful of epidemiologists, the equivalent of today's disease modelers, realized that influenza pandemics came in waves, with the second and third waves usually being more dangerous or mortal than the first wave. The result was that, just like today, in 1918, the initial outbreaks were not taken sufficiently seriously. Indeed, many people dismissed the Spanish flu as a joke. A good example is the war poet Wilfred Owen. So this is a quote from a letter that Wilfred Owen sent to his mother, Susan Owen, from a British Army camp in North Yorkshire in June 1918, shortly before he rejoined his regiment in northern France. And he writes to his mother, quite 1/3 of the battalion and about 30 officers are smitten with the Spanish flu. The thing is much too common for me to take part in. I've quite decided not to. Imagine the work that falls on unaffected officers. Now, these sort of dismissive patrician attitudes only really changed with the second wave of Spanish flu in September 1918. This time, the virus didn't just cause people to fall sick in large numbers, as it had in the spring, it also sparked fatal pneumonias and a deadly condition known as heliotrope cyanosis. For instance, at Camp Devens in Ayer, Massachusetts, so many soldiers were sickened that makeshift beds had to be installed in the corridors of the base hospital in order to take the overspill. The faces soon wear a bluish cast, recalled Victor Vaughan, US Army medic at the time, and who had witnessed the death rattles of the worst afflicted officers. And he continues, a distressing cough brings up the blood-stained sputum. In the morning, the dead bodies are stacked about the morgue like cordwood. Today, intensive care doctors in New York, Madrid, Rome, and London are seeing very similar lung pathologies. Indeed, the prognosis for patients with severe COVID disease is grim. Without ventilation to support their breathing, between 1/3 to half of patients admitted to ITUs will die. But for the vast majority of the population, COVID is a mild illness, and many people will be infected without noticing they have any symptoms whatsoever. The problem at present is we have no idea what percentage of the population may be asymptomatic. So serology tests suggest that 1/5 of New Yorkers may have now been infected, but in communities along the Hudson Valley and in other rural areas, that percentage falls to below 5%. Nonetheless, current data suggests that the population risk of dying from COVID is between 1% to 2%, and in disadvantaged communities, possibly as high as 3% to 4%. That is a very similar rate to the Spanish flu, which, depending on living conditions and whether communities enjoyed a degree of prior immunity, had a mortality rate of between 2% to 5%. It remains to be seen whether COVID-19 will prove as catastrophic as the 1918 Spanish flu pandemic. No one can say at present. But with 280,000 deaths being reported globally, and forecast that as many as 240,000 Americans could die by the time the pandemic has run its course, I'm afraid the echoes are growing louder by the day. As Andrew Neumer, a medical demographer at the University of California, Irvine, puts it, and I'm quoting, "This is unlike anything I've ever seen in the United States, short of the 1918 influenza pandemic." For me, the suspicion that history might be about to repeat itself came in February this year when I first saw those distressing images from Wuhan showing patients besieging hospital emergency rooms and clamoring for treatment. But what really raised my hackles were the images from China of a hospital being erected overnight and of vast waiting rooms filled with row after row of cubicles for the expected coronavirus patients. For me, those pictures recall nothing so much as this haunting image from 1918, showing an emergency influenza ward at Camp Fonston, a US Army training camp in Kansas. In the image, we see row upon row of men laid out in cots, following a flu-like illness that swept through the camp in the spring of 1918. So many men were sickened, we're told, that the base hospital was rapidly overwhelmed, hence the requisitioning of this vast auditorium for the overflow. Now, the majority of patients suffered nothing more than a brief 3-day fever, but about 1/5 of the 1,200 men who were hospitalized developed aggressive pneumonias, and 75 of them died. Now, whether or not this image depicts a herald wave of Spanish flu is hotly contested by historians. What is certain is that in May 1918, millions of Spaniards were suddenly stricken by a very similar disease, as were thousands of American and French troops en route to the front line of the war in Europe. And by the early summer, large outbreaks marked by unusual mortality in young adults, a hallmark of the later pandemic waves, was also being reported in Copenhagen and other Northern European capitals. It's simply too early to say whether the waves of COVID-19 now sweeping the United States and other countries are merely the first in what could be a series of severe epidemic peaks. But if history teaches us anything, it is that pandemics usually come in waves, and that rather than ignoring the scientific evidence, we should prepare for the worst and hope for the best. Thank you very much for listening to my talk, and I'd be very happy to take questions.
Thank you, Mark. That was a fantastic overview of some really important information. And I know that we've got so many people in our audience who want to ask questions and hear more. And so I first am going to ask you some of my own questions.
Okay.
There's a lot that we could cover, but first, what's really coming to my mind, just with this historical perspective and knowing all that we have learned and can learn from the past, why do epidemics keep taking us by surprise?
That is an excellent question. Thank you, Sabrina. So I'll try and keep my answers short. I mean, there are two principal reasons that I identify. One, and the easiest to understand, I think, is this cycle of neglect. So typically, we become very focused on infectious disease and epidemics when they're occurring, for obvious reasons. But the history of the recent run of epidemics is that cultural amnesia sets in almost immediately the epidemic is over. There was a brief period where everyone says, yeah, we should invest more in vaccines and medical therapeutics. And often you see a bump in the funding for the National Institutes of Health and similar research organizations in Europe. But very quickly, other priorities come up, other priorities are raised, and the epidemic drifts from view and people get on with the next problem or the next crisis. So that's one reason. And the particular lessons we forget, I think, are that a lot of the epidemics and pandemics we're seeing have to do with the sort of ecological, the way that the world's become a much smaller place in terms of the epidemiology of these diseases, and the ways in which we forget the ecological and social lessons of past outbreaks. But the other key reason that I think we're not very good at this still is because scientists typically only know as much as they've discovered in the last epidemic or outbreak. So a very good example of that is when Ebola arrived in West Africa in 2014. Scientists had never seen an Ebola outbreak in West Africa. All the previous 11 large outbreaks have been in Central Africa. So at first people couldn't believe that it was Ebola. They thought it was going to be malaria or some other disease with similar symptoms. And even when they realized, oh, this is the same strain of Ebola we've seen in Europe, nobody could believe that it would actually be capable of causing outbreaks in large open areas, because all the previous outbreaks have been in remote forested areas and they never reached a major city. Then, of course, what happened is Ebola reached the capitals of Liberia, Sierra Leone, and Guinea-Conakry. No, that outbreak wasn't even over before we had Zika. Again, another unexpected. So the interesting thing about Zika is we'd known about this Zika virus since 1947. It was first isolated in Uganda in 1947. But like coronaviruses, most virologists didn't consider it particularly interesting. It wasn't something you'd research and build much of a career on. So people just ignored it until it caused a large outbreak that couldn't be ignored. So one of the things I think is at play is the way that our knowledge, of course, can help us devise, therapeutics and predict and prevent pandemics, but it can also create these blind spots to the epidemic just around the corner.
Yeah, agreed.
Mm-hmm.
You were speaking about ecology, particularly. I'm wondering, what role do you think environmental and ecological factors play in the emergence of these new pathogens?
Okay, so again, I think that's a really important question, especially right now, where there are all these conspiracy theories circulating about this Wuhan laboratory, right? People speculating, could the virus have somehow escaped from the laboratory, or by accident, or maybe it was a deliberate escape. Well, I mean, there will always be conspiracy theories, but a much more obvious explanation, and one we have lots and lots of evidence for, is that viruses like coronaviruses and Ebola are spilling over from remote animal habitats all the time. And indeed, veterinary ecologists, as you'll know from your outbreak exhibition, have gone into caves in southern China to take samples from bats that are believed to harbor coronaviruses. Similar work has been done in Africa with bats that are thought to transmit Ebola. And we've also done serology sampling of populations who live close to wildlife in these areas. And lots of people have antibodies to coronaviruses and Ebola. They discovered when they first realized that HIV had probably come out of some population of chimpanzees in Africa, and they went back and looked at blood that had been collected in the 1950s in the Congo. They found Ebola antibodies. Okay, so we know that because of the way human populations are encroaching more and more on previously remote animal habitats and farming close to places where bats roost, or going into caves to collect bats to eat, right? That all that increases the risk of a spillover event occurring.
I'm curious, in 1918, how well did the public understand the origins of the influenza virus? Did they have any conception of its zoonotic history, that birds were a reservoir, or even where the human strain came from more directly?
Well, no, I mean, so at that point in history, no one had any idea that influenza might be, as we call it, a zoonotic, an animal origin virus, much less that it originated in wild waterfowl, so ducks and other sort of flying birds. That only came, the beginnings of that knowledge or that realization really came in the late 1970s and the 1980s, when the first avian influenza viruses were identified. But the key breakthrough, I think, came in Washington, D.C. at what was then the Walter Reed Army Institute for Medical Research, now part of the National Institute for Allergy and Infectious Disease, where a brilliant young molecular pathologist, Jeffrey Taubenberger, who I believe has done talks for your exhibition, managed to reconstruct the entire genome of the Spanish influenza virus. And in his words, he discovered that it was very closely related to avian influenza virus. Indeed, he called it the most avian-like influenza pandemic virus he'd ever seen. Unfortunately, we don't know precisely what type of bird or wild waterfowl it may have come from. I believe he actually looked through the stores at the Smithsonian in search of preserved birds from the Edwardian period, but wasn't able to turn up any viable viral material.
Indeed, he did. Yeah, that work is ongoing, no, it's fascinating what our collections can yield for information. Another question I have about back in 1918, how people were responding and reacting in ways that we can think about compared to today. Were people wanting or valuing hearing from scientists? Were they making demands for science-based decision-making and seeing their leaders following evidence-based recommendations?
Yeah, that's a very interesting question. So I think in two parts. I mean, in Europe, in Britain, France, and other countries that were party to the First World War, and to a lesser extent, America, in 1917, once you became a party to the European conflict, the war dominated everything. People really weren't focused all that much on influenza. Yeah, of course, but then virology, the then specialist scientists of the day were worried, and they were conducting research near the front lines. But for the vast majority of the population, influenza was not a particularly terrifying disease. Very few people, the previous pandemic had occurred in 1890. So that was, a full, almost 28 years, in the past. So very people recalled that influenza could cause very severe pneumonias and, respiratory disease. There were calls by scientists for, better public health messaging. So in the UK, generally speaking, it was left to local public health officers, what we call medical officers, to plan a response. And in some cities, they took it very seriously. So they issued very similar warnings to the ones we see today about the need to isolate yourself, to socially distance, to avoid riding trams and subways unless you needed to. But the overriding priority was to keep the engines of the economy turning for the war, right? So women continued to go to munitions factory to produce shells. In the United States, some cities like St. Louis took it very seriously and tried to warn people not to, gather in public. San Francisco famously introduced an ordinance on requiring people to wear face masks with fines if they didn't. But there was no kind of uniform policy, and most people, towards the end, there were hopes that there might be a vaccine using these bacterial cultures. But I don't think outside of the army, most people were really very hopeful or demanding much from scientists at the time.
I believe that there's that very famous example in Philadelphia, right, of a parade that was in support of the war effort, the Liberty Loan Parade. And there was no public health messaging to prevent, hundreds of thousands of people from gathering at a time when it was known that this was a threat. And I believe they saw their biggest spike shortly thereafter. Is that right?
Yeah, so that's right. So Philadelphia, the famous sort of study is a tale of two cities, Philadelphia and St. Louis. One which had St. Louis, they managed to famously flatten the curve, as we say now. But in Philadelphia, they saw a very sharp peak and a long tail. And the economic impacts were much worse in Philadelphia, by the way, than they were in St. Louis. I mean, I think the thing you have to recall, of course, is that Philadelphia was a major, that's where a lot of the vessels, the shipbuilding industry, I guess it was harder to sort of stop everything down there because of the war effort. But it's interesting to compare those differences and see how it played out. I mean, the other thing I have to say very quickly is, of course, the influenza pandemic, the worst wave, occurred in October, November of 1918. And of course, on November 11th, the war was over. That was Armistice Day. So of course, everybody wanted to go out and celebrate and have a big party. It was pretty hard to stop people hugging in the streets at that point.
Yeah. Well, we are now going to take some questions from our audience. We have many, right?
Okay.
Try to get through as many as we can. And so the first one I'm going to ask you is, obviously, the economic effects of COVID are more serious because of closures and stay-at-home orders. However, how come the 1918 pandemic did not have the same economic consequences that we see today?
So, I mean, that is actually an extremely difficult question to answer. There has been, part of the reason we can't answer it very clearly is, unlike today, governments didn't keep detailed economic data in that period. But from most of the information we have, probably the main reason was that the whole economy was on a wartime footing. Okay, so when the Spanish flu came along, it actually wasn't allowed to disrupt the wartime economy all that much. Yes, it did depress GDP. Some estimates say it depressed production by as much as 5%. Like today, there were many businesses that went out of business, but there were some businesses that did well. Just as today, there are some businesses that do well, like Netflix and Amazon. That was the same in 1918. And the kind of paradox is that although, of course, it was devastating if you lost your business or you lost a breadwinner, right? For those who survived, there was more capital available, right? And you could then profit from that, because not only was capital more available and cheaper, but you could command higher wages for your labor. So many people, as I said in my short talk, actually, the economy pretty quickly, the evidence seems to be the economy pretty quickly returned to the previous steady state that it obtained before the war.
Interesting. Okay, I've got a question here from Tina. There's been much discussion of the political governmental response to COVID-19. Give some highlight to the governmental response to the Spanish flu and draw parallels and divergences between then and now. Talking about political governmental responses. Yeah,
so I mean, the thing to understand is that in 1918, we didn't have like, in the UK at least, and I believe the same is true in America, we didn't have like centralized health departments or ministries who were directing health policy across the whole country. I mean, I suppose you don't really have that today in America, because you have the federal government, the states, and they often don't see eye to eye. But I mean, the one thing you didn't have in the United States, obviously, at that point, you didn't have the CDC or the National Institutes of Health. And in the UK, we didn't have a Department of Health. So right now in the UK, every day there's a briefing, right, on TV. And in other cities in America, like in New York, you can tune into Andrew Cuomo's briefing. And I'm sure that the same is true in other states in the nation. That didn't happen in 1918. It was much more fragmented. Yes, there were some broad public health messages that went out. Interestingly, they were very, very similar to the messages we get today. So, some people advocated face masks. The key thing was cover your mouth when you sneeze or cough. I love this phrase that people were told not to expectorate in public, which is a polite way for saying don't spit in public, right? Which is good advice, whether or not there's a pandemic going on, I think.
Very polite, yeah.
But I mean, the main advice was because medicine was pretty much powerless, as it is, well, pretty much powerless to treat flu. There was little doctors could do. They couldn't just prescribe any particular drugs or medications. So people were advised just to stay at home, isolate themselves, make sure they get plenty of bed rest. And all they could do was use a cold compress for the fever. Some people took quinine, because quinine, which is a specific form of malaria, was thought to, in the same way that it acted on the fevers and chills of malaria, people hoped that it might have the same effect on influenza. It didn't. And the only other things that were available were aspirin or morphine or opium, just for the relief of the pain and discomfort.
Okay, I've got a different kind of question from Ashley. What is the best way to talk to people who seem to think that this epidemic is a conspiracy somehow or fake? Do you have any idea about that?
Yes, I've thought a lot about that, because I actually recently devoted an episode of my podcast, it's called Going Viral, COVID Files, to, I think it was called, they think they're controlling your mind or something like this, because my answer to that is like this. For me, there are two types of people on this conspiracy theory spectrum. There are people who, like Alex Jones of InfoWars, who I call conspiracy entrepreneurs. These are people who are making money from peddling conspiracy theories that they may not necessarily believe or change all the time. So I single out Alex Jones merely because you know, he infamously claimed that Sandy Hook was a hoax perpetrated by child actors. But when he was brought to trial to defend that, he said he didn't believe it at all, and he was merely performing. You know, he was merely a performance artist. So I think that there are hardcore conspiracy theories who nothing you can tell them will convince them otherwise. But then I think there are a lot of people who are genuinely asking questions, who may not fully trust scientific authorities. And sometimes they're right not to trust the experts. The experts don't always know everything. Sometimes they go beyond their disease models of the evidence to make claims that aren't really supported. So I think it's healthy to be skeptical and to ask these questions. And these people I put in the category of they're hesitant, you know, so we talk about vaccine hesitancy. And I think in that case, I mean, the solution is just better science communication and really trying to raise the scientific literacy of the general population. So that's something that can only really start in schools, and it can continue through university, or organizations like the Smithsonian can play their part by hosting events like this.
Thank you. Yeah, we try. It's good advice. So, all right, back to 1918. This is a question from Jeff.
Yeah.
There's 3 questions. Okay. Was a vaccine developed before the Spanish flu? How long did it take to be dispersed, widely enough to take effect? And what would be the comparable time for COVID-19? You talked about vaccination.
So there was no vaccine in 1918 in the sense that Jeff, and we may understand vaccines today because they didn't know it was a virus. So what they did is they produced what are known as mixed. So basically, they took throat washings from patients, or in some cases blood. So with the blood, they can make crude serum vaccines hoping that there are antibodies in the blood. Or more commonly, they created mixed bacterial vaccines. So that took place, I know, in New York, and most of the research, though, was being done by the Army or the Navy. And there were trials, and these vaccines were administered to people in the military or in the Navy. But to my knowledge, I think very few found their way to the general population in 1918. Today, I think that there seems to be a very good chance that we may have proof of concept of a vaccine by the end of this year. There's a group in Oxford who have said that they've got very high hopes. They've started clinical trials, but that's only the first stage in a long process because, you know, there are phase 1, phase 2, phase 3, and the shortest that can be completed is 18 months.
Okay, well, now we've got a question from a younger audience member, Isa, I believe, ISA, age 7.
Gosh.
My mom is an epidemiologist and has been talking about what our family can do to stay safe. What were the most important ways families stayed safe in 1918 pandemic flu?
Well, that's another very good question, you see, because the fact is that, as I tried to say, I think most people were only really aware of the flu once it was already very widespread in the community. And even so, unless you actually knew someone who was bedridden or you actually had a relative who had been hospitalized, you might not have been fully aware of it. But there's certainly evidence that in many communities across the United States and also Britain, communities, just as they're doing today, pulled together, and they couldn't rely on the state or central authorities. Doctors, you have to. The other thing is many medical professionals, doctors and nurses, were away at the front, or with Army or the Navy. So there was a shortage of doctors on the home front. So doctors were run off their feet. So it was really quite often either elderly people grandparents who cast in the role of caring for their sons and daughters, because remember, the flu was most deadly to younger age groups, adults 20 to 40. And you often, young children, as young as this young woman asked the question now, children as young as 7 or younger, were the ones that had to go out and, you know, get milk or bread. There are even some heartbreaking accounts of, you know, children losing both parents and having to sort of arrange for the funeral rites. Yeah, heartbreaking.
That is heartbreaking. A question from Ira. How can we minimize the occurrence and severity of future pandemics? Do you have any thoughts or advice on that?
Yeah, so I think so. There's two things. I think that coronavirus, although it's dreadful and, you know, tragic, and we wish it never happened, in some ways it may have done the world a favor. So why do we have this major outbreak? It's not because, in my view, there was an accidental release from the laboratory. It's because of the way that we're so reliant on mass production of animal protein, the way that in China and other fast industrializing areas of the globe, we create these huge cities with massive populations that need to be fed. In order to do that, we farm more and more land to raise pigs and poultry and cattle. That puts more and more pressure on remote animal habitats. We build roads to these places. We then connect those roads to cities, and we connect those cities by plane to our cities. So what we create is a much smaller world from an ecological point of view. And what we need to do is realize that climate change is also playing a massive factor in the emergence of coronaviruses and Ebola viruses and all the other viruses that might be out there that we've yet to discover. So I think this is a massive wake-up call that the health of the planet is not a distant threat, but something that can be an immediate existential threat today whenever there's a pandemic emergence. And the other very simple lesson is coming back to this idea of the way you know, our own knowledge can blind us. We have to be alert. We have to be alert always to the unexpected, right? And we have to sort of say, once this is all over, we have to say, okay, this time we're not going to forget what we just went through. We're going to use the interval between the end of COVID and whatever the next pandemic is to prepare. Let's prepare, let's invest money. Let's devise vaccine platforms so that we're ready for the next unexpected virus.
Thank you. Appreciate, yeah, the ecological lessons and awareness that we all have to have. Our next question is actually going back to economy. A question from Richard. What are your thoughts on how effectively we are maintaining a balance between prioritizing public health and the health of our global economy, which could suffer negative impacts from businesses remaining closed through social distancing?
Okay, so yeah, that's again a very good question. The $64,000 question, if you like, well, probably a lot more now. I don't think there are easy answers to this. I think that obviously the economy is important, and obviously the longer we stall and halt the economy, the greater the risk that there will be worse health repercussions further down the line. Either because right now there may be many people with cancer or other conditions who aren't going to hospital for treatment and therefore are dying unnecessarily right now, or who will this year. Or because by stalling the economy, people lose their businesses, they get into economic hardship. That can also cause physical and mental health problems and shorten life expectancies. So we do have to find a balance. And I think right now, we have to accept, first of all, that this isn't going to end anytime soon. So we have to kind of make a mental adjustment that we're going to be living with COVID for at least till the end of this year, probably longer, and at least until we have a vaccine. So, you know, it's not going to be about flattening this curve. There are going to be a series of little humps and bumps as we, you know, go on. So economic activity can come back. So we have to be smart. I think we have to be smart about what economic activity we allow and the way in which we manage the economy and things like schools so that we reduce the risk as much as possible. And remember, we have something we didn't have in 1918. We have technology, we have Zoom. Imagine how we would be feeling if we didn't have this amazing ability to communicate.
Absolutely, yeah. Feeling the love and, not so much with Zoom day to day, but we are fortunate to communicate. And so, yeah, looking more positively, we've got a question from Michael. Are there any examples of effective responses to pandemics that you could offer or point to?
Well, I think the best recent example would be, it wasn't a pandemic, but it could have been, which was Ebola in West Africa, right? So what happened is we were very late to wake up, to the outbreak and the risk it posed to West Africa. But we were very late to realize that it didn't just pose a risk there. Ebola did get to Lagos, one of the largest cities in Africa. And there were also introductions to New York and by a business traveler who arrived in Dallas. So it could have been very much worse. What stopped it was that the United States, but also France and Britain, mobilized the biggest medical and humanitarian response in history, right? We threw in medical supplies. We built hospitals overnight. We created triage centers where Ebola patients could be isolated. And most important of all, we tested people and we dispatched people to trace their contacts and the contacts of the contact. And what we did by doing that is we drove transmission of Ebola to zero. It took until 2016, but we snuffed out that outbreak. And we need to do the same thing today. That's the way we get our economy back, by having, like a sort of space race Manhattan project for testing and contact tracing. And a lot of people can be involved in that. Not necessarily, you don't have to necessarily have to be a nurse. You can be an environmental health officer, someone who can be retrained and to be a volunteer and go out into the community and, help take those histories and chase down those contact trains.
And I guess it's true that with really effective measures, you'll never know what you prevented, right?
Yeah, exactly. That's the thing. I mean, we see all these horrible disease models and projections, but remember, those are possible futures that we hopefully will never visit. Hopefully, we're never going to see 1 million deaths from COVID in the United States.
Well, we are getting close to the end of our time, but I think we have we can do at least one more question that I have here from Gimbia. I have young children, and we have begun distance learning and looking at possibly considering it next year. I also have friends who are thinking about implications of online learning for college-age kids next semester. What happened with education interruptions in 1918? What tools can help us understand when it is safe to go back to school?
Wow, so I actually have to say I'm not aware of what sort of interruptions there were. I think there were some cities or towns where they did close schools for short periods. So yes, obviously there must have been massive disruptions. I'm guessing that the burden fell on parents or brothers and sisters to school children or to occupy them when they weren't at school. Obviously, there was no such thing as Zoom or distance learning in 1918. So I imagine that's went on. But a lot of children continued going to school in 1918.
Let's do one more. Because we did speak about ecology and economy, but this is about culture.
Yeah.
I say that the pandemic shifts from view and the changes to the medical field are short-lived, but can you speak to larger cultural shifts that may occur after an outbreak or a pandemic?
Yeah, so again, an excellent question, and you're in Washington, D.C., so I'm old enough to remember the HIV/AIDS pandemic in the early 1980s, and we saw a massive cultural shift there. So because it was so important for the groups that were badly affected by HIV, principally gay men and women, and also other sort of groups like hemophiliacs. What we saw were this massive quilt, right, on the mall. So people memorialized the suffering or deaths of loved ones by creating these quilts, and then they joined them all together and they unrolled that all, and it occupied most of the mall in Washington. It was one of the biggest or weightiest memorials to a pandemic in history. But also in terms of culture, you can trace a lot of the cultural changes we take for granted today, such as gay rights. The whole idea of woke culture had its roots in the response to AIDS, because it politicized the whole generation about how important these issues were. And why did it politicize them? Because people were stigmatized, particular groups were blamed and stigmatized for AIDS when it's a virus that can affect anybody. So you don't see that typically with influenza pandemics, because influenza is universal. Anyone can get it, much like COVID. But of course, we know that COVID is also disproportionately affecting people in poorer neighborhoods, urban neighborhoods, where they may be in more crowded living conditions. So I think it's also going to have political ramifications because of that. And we've seen already that people are saying we've got to fund our public hospitals better, right?
Well, thank you so much, Mark. You've shared so much with us, give us a lot to think about. I learned a lot. It was lovely to have you back with us for our programs. For our audience, please fill out the survey that you'll be prompted to take at the end of this program. It can help us improve them. We look forward to offering more. I think there's a link actually to that survey in the chat box, so check that out. And keep your eye open. Check back with us. We're on our events page for more programs to come. We love doing this and are very pleased to bring you all this. And keep an eye out for Mark's updated book, right? COVID-19 updated version of the pandemic century. So again, it's a pleasure. Everyone, stay safe, be healthy and well. Have a great day.
Thank you. Thank you for your question.
Thank
Bye-bye.
you.
Bye.